blood test can tell if a person is vitamin deficient. The human body relies on a delicate balance of nutrients to maintain optimal health, and vitamins are a key component of this balance. Vitamins perform a range of important functions, from energy production to immune system support. A lack of any of these essential nutrients can lead to a variety of health problems, many of which may not be immediately apparent. With the advancement of modern medicine, one of the most effective ways to identify vitamin deficiencies is through blood testing. Vitamin D plays a vital role in bone health, immune function, and overall health. It is a fat-soluble vitamin that the body produces when the skin is exposed to sunlight. However, many people do not get enough vitamin D from sunlight alone due to a variety of factors, including limited sun exposure, widespread use of sunscreen, geographic location, and lifestyle. This deficiency may also be caused by insufficient dietary intake or an underlying health condition that affects absorption of the vitamin. Concentrations below 20 nanograms per milliliter usually indicate a defect. Many people with low vitamin D levels are asymptomatic, meaning they show no obvious signs of deficiency. Others may experience symptoms that affect their quality of life. Common symptoms of vitamin D deficiency include low vitamin D levels can cause bone pain and muscle weakness. In children, severe vitamin D deficiency can lead to rickets, which is characterized by osteoporosis and bone deformities. People with insufficient vitamin D levels often experience tiredness or low energy, which can be subtle but persistent. Causes of vitamin D deficiency. Limit sun exposure. Dietary insufficiency. Although certain foods contain vitamin D, such as fatty fish, fortified dairy products, and egg yolks, many people do not consume enough of these foods to meet their daily needs. Malabsorption syndromes. Certain gastrointestinal disorders, such as Crohn's disease, celiac disease, and cystic fibrosis, may impair the body's ability to absorb fat-soluble vitamins such as vitamin D. Kidney or liver disease. The kidneys and liver play an important role in converting vitamin D into its active form. People with chronic kidney or liver disease may have difficulty producing active vitamin D once vitamin D deficiency is detected through a blood test. Treatment usually involves increasing vitamin D intake through supplements or dietary modifications. For people with limited sun exposure, spending more time outdoors can help increase vitamin D levels naturally. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that is essential for the production of red blood cells, DNA synthesis, and the proper functioning of the nervous system. Normal range: 200,900 picograms per milliliter. Vitamin B12 deficiency can cause a variety of symptoms, many of which are related to impaired neurological function and anemia. Symptoms often appear gradually and may go unnoticed until the defect becomes more severe. Fatigue and weakness. A common symptom of vitamin B12 deficiency is megaloblastic anemia, a condition in which red blood cells are larger and fewer in number than normal, causing fatigue and general weakness. Nervous system problems. Vitamin B12 is essential for maintaining the myelin sheath that protects nerves. A deficiency can cause nerve damage, causing numbness or tingling in the hands and feet, difficulty walking, memory problems, and mood changes. Because vitamin B12 is found primarily in animal products such as meat, fish, eggs, and dairy products, people who follow a vegan or vegetarian diet are at higher risk for vitamin B12 deficiency unless they consume fortified foods or supplements. Pernicious anemia is an autoimmune disease that affects the stomach's ability to produce intrinsic factor, a protein needed to absorb B12. Without intrinsic factor, vitamin B12 cannot be absorbed properly, leading to a deficiency. As we age, gastric acid secretion decreases, which may lead to malabsorption of B12 from food. This is why B12 deficiency is more common in older adults. Folic acid, vitamin B9, deficiency and blood tests. Folic acid, also known as vitamin B9, is a water-soluble vitamin that is essential for DNA synthesis, cell division, and the production of red blood cells. It plays an especially important role during pregnancy, as adequate folate levels help prevent neural tube defects in the developing fetus. Folic acid deficiency can lead to a variety of health problems, including a type of anemia called megaloblastic anemia, and is often confused with vitamin B12 deficiency because both can cause similar symptoms. How to test folate in blood. Serum folate deficiency, less than 3 nanograms per milliliter. Red blood cell folate deficiency, less than 140 nanograms per milliliter. Symptoms of folate deficiency include megaloblastic anemia. This type of anemia is characterized by the production of abnormally large immature red blood cells. Symptoms of anemia include fatigue, weakness, shortness of breath, and difficulty concentrating. Neurological symptoms. Although folate deficiency is more closely related to vitamin B12 deficiency, folate deficiency may also cause neurological symptoms such as numbness, tingling, or cognitive difficulties, especially if it occurs at the same time as vitamin B12 deficiency. Digestive problems. People who are folate deficient may experience digestive problems, including nausea, diarrhea, and a sore or swollen tongue. Folic acid is found in green leafy vegetables, legumes, and fortified cereals. A lack of these foods in the diet can lead to malnutrition. Vitamin A is a fat-soluble vitamin that is essential for maintaining good vision, immune function, and skin health. Normal range: 0.7 to 2.5 micromoles per liter. Vitamin A deficiency can cause a variety of symptoms, most notably affecting vision and the immune system. This deficiency is more common in people whose diets include limited intake of animal products and vitamin A-rich vegetables. One of the earliest and most obvious symptoms of vitamin A deficiency is night blindness, a condition in which people have difficulty seeing in low light conditions. Vitamin E is a fat-soluble antioxidant that protects cells from oxidative damage. Normal range: 12 to 46 micromoles per liter. Vitamin E deficiency primarily affects the nervous system, as this vitamin is essential for maintaining the integrity of cell membranes and nerve function. Symptoms may include peripheral neuropathy. Deficiency can cause damage to peripheral nerves, causing symptoms such as numbness, tingling, and weakness, especially in the hands and feet. Vitamin C, or ascorbic acid, is a water-soluble vitamin that is essential for collagen synthesis, wound healing, and maintenance of cartilage, bones, and teeth. It also acts as a powerful antioxidant, helping to protect cells from oxidative damage. Normal range: greater than 28 micromoles per liter. Vitamin C deficiency can be treated by taking oral vitamin C supplements or increasing your intake of vitamin C-rich foods. Including vitamin C-rich foods in your diet, such as oranges, strawberries, kiwis, bell peppers, and green broccoli, can help prevent vitamin K deficiency. Vitamin K is a fat-soluble vitamin that plays a role in blood clotting and bone metabolism. Prothrombin time: normal range is 10 to 14 seconds. Plasmaphyloquinone concentration: normal range 0.2 to 3.2 nanomoles per liter. Vitamin K deficiency primarily affects the body's ability to form blood clots, leading to bleeding disorders. Vitamin K deficiency may occur if people don't get enough vitamin K from foods like leafy green vegetables, broccoli, and Brussels sprouts. The disease is more common in people who eat strict diets or don't have access to fresh produce. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin that participates in more than 100 enzyme reactions, mainly involved in protein metabolism. It also plays a role in brain development, immune function, and the production of neurotransmitters such as serotonin and dopamine. Vitamin B6 deficiency can lead to neurological symptoms, skin disorders, and anemia. Vitamin B6 deficiency causes a range of symptoms, primarily affecting the skin, nervous system, and blood cells.